Hi, I'm Samantha Bell, and the issue that I have evaluated is the impact of individual therapy for children who exhibit behavioral issues in the classroom due to previous trauma exposure. I picked this issue because of the prevalence of unaddressed behavioral problems in children. According to research, 1 in 5 children have diagnosable behavioral disorders. However, about 20% receive the treatment that they need. And during this COVID pandemic, there has been a greater prevalence of behavioral issues in children. The purpose of the study was to not only implement effective intervention for these children, but it was also to exhibit and provide necessary measuring tools for the teachers to implement in their classrooms as a common practice. I used a non-equivalent control group design for this study. Within this design, children who did not receive individual therapy initially were designated as the control group. Although they were intended to not receive therapy, I felt that this group, the control group, would be considered unethical, not giving children opportunity to effective intervention. So the control group actually received delayed treatment. I first conducted a pre-assessment prior to both groups engaging in treatment. This provided the number of behavioral incidents for the current month. The therapy was then provided as the intervention to population 1. I conducted a follow-up assessment in this population to determine any changes of behavioral issues. These steps were also repeated for the second group who received the delayed treatment. Students were randomly assigned to each group. They were retrieved per referral by their teachers, and student selection was confirmed after parental consent was received. The timeline for my project was 9 weeks per each group, totaling 18 weeks. Sessions for counseling occurred weekly during the after-school program and were conducted by licensed clinical social workers. The instrument that I used to assess behavioral incidents in the classroom was called the Connors Teacher Rating Scale. The teachers actually recorded this during each 9-week session. There are 28 questions in total, with scores ranging from numerical 0 to 3 in each category, meaning never, occasionally, often, and very often that instance of behavioral issues occurred. After the study concluded, my findings did support the hypothesis that children in population 1 who received therapy had fewer incidents of behavioral problems in school than the children in population 2 who did not receive therapy during the initial 9 weeks. The pretest scores did not vary between the two groups significantly. However, post-testing results indicated that population 1 did exhibit fewer behavioral issues than population 2. And these results indicate for social work practice that therapeutic intervention can actually benefit children experiencing behavioral issues at school. I found that the first group to receive treatment immediately began showing less signs of behavioral issues. This improved behavior was maintained throughout the entirety of the study. A problem that I encountered during the study was participant dropout at various stages of the program, in addition to a lack of consistency in attending weekly sessions among many participants. Also, the level of teacher expertise with completing the Connor Teacher Rating Scale was limited, and therapeutic expertise and techniques varied among the licensed clinical social workers. If my study was replicated, I would advise researchers to obtain a large sample size and to also conduct a follow-up rating scale 1 year after treatment to assess if behavioral modification was maintained or was becoming a problem again due to lack of treatment. Another aspect to consider for future research would be to include more examiners to assess behavioral problems, including parents, in addition to the teachers and therapists, can help provide further insight into behavioral outcomes. Lastly, future researchers should be mindful that other causes of behavioral issues beyond a trauma context may occur with children. So other interventions should always be considered to best assist the specific needs of each child. Thank you for listening.